Let's go to Adia Benton from Brown University and ask you this question. Is it tough for Americans to connect to this? It is far away. It's not affecting us directly. We've had these couple of cases where some of the workers were flown back here and cured. Are we not connecting with this as Americans?
I think people are connecting with it very deeply. I have people contacting me all the time trying to figure out how they can help, how they can send gloves and protective gear to people, where they can send their money. So I don't think that the connection problem is a problem. But I think that one of the ways, and I think, Mrs. Sharif was very smart about saying, is the American government was primarily concerned, and the American media was primarily concerned when they thought it would come on a plane. So we have a bit of a disconnect. Here in Providence, there are Liberians who are collecting money and goods to send over to Liberia. In Sierra Leone, there are communities that are self-quarantining, that are sending people to doctors. There are communities that want to know how they can actually do better work. How can they have chlorine gloves in their communities for women who may be the first line of healthcare? We're talking about health systems that were broken and have had lots of money put into them, but haven't really produced the kind of broad-based care that's necessary to address epidemics.
All right, let's bring this back to the panel for a second. For a lot of Americans, Africa might as well be the other side of the moon. It's not a concern, it's not worried, and Ms. Benton mentioned a moment ago, until it came to our shores, it became a story then, but until that point it really wasn't. Is there a disconnect in the media? Is there a disconnect in general?
I think it is a natural reaction for us to worry about it coming here. But I agree with what's just been said. There's a disconnect in the sense that we're worried about it coming here, but what are we going to do about it? And I think Dee Dee's probably on the right mark here, where we
Hold
really.
You're agreeing with Dee Dee?
I am. Yes, I think we really did a lot to assist Africa in the previous administration. We should really do something to make a difference here, and I think we can by better communication.
Dee Dee?
Yeah, I think there was a disconnect, but right now we are getting it. And if that fear makes us give billions of dollars to Africa, so be it. That is a good cause and effect. And I do think people are understanding it, and there is a fear. But if it does help Africa, it's going to help the whole world.
You know, I asked this question myself when we brought these two aid workers who were ill, and we cured them eventually here. Why didn't they ship everything they needed over to Africa, including generators, so they would make sure, instead of bringing this virus into the United States? Silly question, but an obvious one for me.
Well, I have the same question, Frank. I think we should have sent everything over. If anything, I mean, it does raise the fear factor. And again, if that makes America react, so be it. It might be a silver lining.
I think the psychology plays out well, that they came here and they were cured, and that we had the resources here. I mean, that's what I'm thinking, Chuck. I mean, what are you thinking?
Right, I mean, I agree with what Dr. Bart just said. I think it makes us look good from a psychological standpoint that America has the resources, the scientists. We have the technology to treat this kind of disease effectively. So I think it was a bit of PR. It makes us look good because we're also giving billions of dollars, as Dee Dee and Dr. Bart mentioned. So we want to add more to that. We're not only giving money, we're also giving our expertise to be able to treat this challenging
All right,
disease.
let's go to D.C. Bureau again, and Ms. Sharif. What are people doing to cope in Africa with regard to this disease? You've been on the ground, so what have they been doing to cope?
Well, I can tell you about what women have been doing. We have formed various coalitions, national coalitions in Sierra Leone. And what we have done is we have tried to find ways in which ordinary people can try and be empowered and take control of their own health.
In what way?
So, for instance, in what way? One example is that as women, we have been self-funding the installation and maintenance of hand-washing facilities in our markets. The director of CDC this week, I heard him speak on NPR, he reiterated the importance of hand washing. And we found that all the big offices, the ministries had hand washing facilities, but there were no hand washing facilities being installed in markets. And yet this is where the food is, this is where the women are, these are the primary caregivers. So we went out and said, let us install hand washing in our marketplaces ourselves. And our market women's executives are running those hand washing facilities themselves and taking care of them. We also decided that we would volunteer to take care of the toll-free call center, so that if you were to call the toll-free number, you could hear women's voices like yourselves telling you about what you can do to keep your family safe from Ebola.
Okay.
So we worked with UNICEF to develop a manual and things, various things like this.
All right, let me hold you there for a moment. I've been surprised, quite frankly, that the big NATO meeting in Wales, there was a lot of discussion about Russia, and justifiably so, in the Ukraine and so on. A lot of discussion about ISIS, and justifiably so. But not really anything about this. And this is a world problem.
It's a world problem, but politics sometimes trumps reality. And that might be a good example where politics actually overran this issue to a great extent.
I think Frank's right, though. There should be more of a sense of urgency.
There should be.
Giving them money, and I actually think this would be a very good move for President Obama to, because he's had a lot of issues.
Sort of latch on to this.
Latch on to it and help with the Ebola crisis. I think that would be very good for him to do.
It seems there's just been silence from these really important nations meeting in Wales, the NATO committee, and this has been.
It's been missing.
Okay,
But there's
let's
so
go
much
back.
going on.
Let's go to Washington.
Could I come in, please,
Yes.
as we're talking about politics,
Yes.
American politics on this? What I would like to point out is that I'm not sure if the other guests know that up till now, we are waiting for the confirmation of the U.S. ambassador designate to Sierra Leone. He has been sitting in Washington or nearby for a year now, and he hasn't been able to go there and, put in his effort and his input and ensure that in Sierra Leone we have the highest level of representation that the U.S. government can give. I think that one thing that all the Americans could do is that if they would pick up their phones and call their Congress people and say to them, can you please confirm the ambassador designate for Sierra Leone so he can go to Sierra Leone and start contributing to the fight against Ebola.
Done.
All right,
Maybe, it is as
Yes, I
important
agree.
to do that.
We're going to give Adia Benton from Brown University the last word. What can we do as Americans to fight this?
Well, I'd like to second that motion, right? And actually ask people to contact their Congress people to get an ambassador there. There are ambassadors who aren't in place in lots of countries, actually. To also make sure, if you are a clinician or a health worker who can get on a plane and maybe help to train on using protective gear, if you have the contact with Liberians, Guineans, Sierra Leoneans who are sending things over and money over, that is helpful. All of those things are very big things. But
Okay. I'm sorry, we have to pay the bill, so I'm going to stop you right there. And thank you very much, our guest via satellite, and also in our DC Bureau and a guest on the panel. We're going to take a break now. When we come back in a moment, we're going to back on a discussion about protests throughout the United States. All this week, I'm sure you've seen them, for the so-called livable wage. We'll be back to talk about that in a moment.